Is the roundtable 4. The session is on making senior care accessible, affordable, and credible. Recognizing the pressing nature of adapting to the evolving requirements of an aging population, there's a compelling need to bolster training and capacity development. Considering the same, our upcoming session will focus on identifying potential innovative ways to increase healthcare affordability by 60 plus population, including initiatives like specially designed insurance products, reverse mortgage loans, GST benefits, expanding the benefit package of existing products, and increasing the overall awareness in this sector. With those words, please put your hands together as I now invite the moderator of the session and the speakers of the session onto the stage. May I invite on stage our moderator of the session, partner and leader healthcare PricewaterhouseCoopers, Dr. Rana Mehta. Very warm welcome to you, sir. May I invite on stage our esteemed panelist, Director, Quadria Capital, Mr. Abhishek Yadav. Warm welcome to you. We also invite on stage CEO NABH, Mr. Atul Mohan Kochhar. Warm welcome to Mr. Kochhar. And may we also invite on stage Advisor Public Health Administration National Health System Resource Center, Dr. K. Madan Gopal. Warm welcome to you, sir. We also have as speaker of the session, Chairman and Managing Director, Bajaj Capital Limited, Mr. Rajiv Bajaj. Very warm welcome to you, sir. Before I request our moderator of the session to take over, may I say a few words about the moderator? Dr. Madan Gopal is going to join us in a bit. May I quickly say a few words about the moderator of the session? Dr. Rana Mehta has more than 25 years of experience in strategizing, planning, commissioning, and operations of over 75 hospitals and healthcare systems in Asia. He has worked on numerous assignments to develop customized healthcare solutions to suit client needs within political, socio-economic, geographic, and demographic imperatives. With those words, may I request the moderator of the session to kindly take over.
Thank you. And thank you. And I know we are the panel between you and lunch, but we'll try to make this really interesting. I think a lot of thoughts from the morning. I think what are the imperatives to invest in this whole senior care ecosystem. But I think we're coming to what's really going to take this whole ecosystem to an inflection point. Because there are going to be three things. Is it accessible for everyone? Accessibility in India, we know, is limited by affordability. Can people afford it? And finally, I think in healthcare, what's the most important thing? That is, can you trust it? Is it actually credible? Because this has held back a lot of ecosystems because these three magic ingredients don't come in. So as we grow it, I think those become very important. I have an amazing panel where they're going to answer just the right thing. Dr. Kochhar obviously is the CEO of NABH, and an expert on the accreditation, because putting in the standards, right? Because ultimately we are dealing with a very vulnerable group, right? Who are skeptical about parting with both their time and their financial resources. I have Abhishek, who is the director of Quadria. And, Quadria is one of the single focused healthcare funds. I was in Singapore recently, and, they're the talk of the town. They've raised over $1 billion. But I think one of the things is they've been very focused on healthcare. A lot of funds say we also do healthcare. But so it's great to have Abhishek. And, I think from an investor and operational point of view, there'll be a lot of questions there. And also, it's great to have Rajiv Bajaj, who, besides being the chairman and managing director of Bajaj Capital, also has a personal interest both in wellness, longevity, and ikigai. So it'll be good to look at how do we do that. So the problem is there, and I think everybody rightly articulated it. We'll have 300 million people above the age of 60 by 2050, and that's the population of Europe, right? So we're dealing with a large problem. A couple of years ago, I went to Japan, and they said, forget the tsunami. It's the silver tsunami which is the problem. We have the greatest demographic dividend, but that's not going to stay for long. And ultimately, how as a society do we react to this problem? I'll start with Dr. Kochhar. Dr. Kochhar, I think the whole component of credibility, trust, here we are where, unlike, the other healthcare sectors, we can actually put in the building blocks. So we like your views on that.
Thank you so much, Dr. Rana. Thank you so much for having NABH here. So I mean, this has been a good discussion. I've been following the past two sessions, and I think it's very important to bring into sharp focus the exact issues which are all have been highlighted. Now, just because many of us may not be aware about NABH, today we are 18-year young body. We are formed by active collaboration of Government of India and all the major industry associations, FICCI, CII, ASOCHAM, and we touch today about 19,000 plus hospitals in India and 8 countries. So we draft and assess against our own standards, which are benchmarked by the best in the world by a global body called ISQA, International Society for Quality in Healthcare. And when I say standards, India is proud to have to be one of the countries, one of the 44 countries amongst the 200 odd countries, which draft their own standards in healthcare. So these standards are very popular, and we have today 27 products which are based on a very solid foundation of credibility. So the word you used, I like that. It's all about trust. How do we know that any facility, whether it's a hospital, is a small healthcare, or it's a blood bank, or whatever services related to healthcare, how do you say that it's a trustworthy thing? So you need a third party body, which I'm very proud to claim that we are, uh, which is responsive, which is transparent, which is technologically sensitive, and 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 can give a honest opinion about what the facility is. So with that kind of a mandate, we set about creating standards. So we started this journey about a year back in active request from CII. Dr. Shabnam Singh was the chair. We brought in all the stakeholders and started to draft the standards for care home facilities. When I say care home, they cover the senior living, assisted living, the hospice, everything, special care. So all those things we need draft standards. So when I say standard, these are published documents. They are available free of charge from our website, and they cover all aspects of healthcare. For example, let's say a hospital like Max or Medanta or anyone, when we speak about them, we have a 10 chapter traditional approach where the first 5 chapters deal with patient care, and the next 5 chapters deal with the facility management, the everything, for the safety, the staff management, etc. For care home standards, we have 6 chapter approach, and we have switched to a core commitment, achievement, and excellence. So they are written in plain English, and so on 17th of September, just gone by, we released the first care home standards for India. So I just got a copy because many of us, I heard, were not aware about this thing. Amongst the digital health standard, which you actively collaborated with us. So these standards are a framework. So what do they don't tell you whether to put a granite in the lobby, or they're not prescriptive standard. They are very enabling, focused framework for adapting your facilities to your scope. So that's exactly what they are. Whatever you wish to, whatever a care home facility, if I can use that word, and just let me also share, there are under Ministry of Social Justice, there are 502 integrated senior care home facilities which are currently operational across states. So they have been under the mandate of that Ministry of Social Justice, where Government of India wishes to bring all those 502 and counting facilities to a certain level. So this framework gives them a chance. And on day one, when we release a new standard, so every 3 years or 4 years, as the case may be, we revise these standards, raising the benchmark slightly. So these standards for care home, they cover not only facility, not only the role of management, not only the HR angle, but also the resident engagement and wellness. So we have 6 chapters here, which cover end-to-end infection control, hygiene, etc. So end-to-end the journey through a care home, which is like it's been mentioned earlier, a very sensitive, extremely sensitive portion where it's bordering on hospitality, bordering on which is not a true hospital, which is may include palliative care, maybe a hospice, but it's a combination of all. So this framework gives that. So we'll be very happy to send a copy, share a copy with everyone, though it's freely available as a PDF on a charge, but we'll be sharing all these copies. So please go through them, give us your suggestions. And the one word which comes to mind is trust. So how a senior or all of us are going almost there, if not there already. Uh, so how can they see value in the facility? How can they be assured that this is a trustworthy facility where their everyone's interest can be taken care of? So NABH steps in for that. Please send us your suggestions, and I truly hope that they'll add much more value to the entire ecosystem. Thank you.
No, thank you, Dr. Kochhar. And I think it's very apt, because I think when the whole hospital revolution or the multi-speciality happened, there were no standards. So everybody was, either they built it according to whatever they thought was right, or they picked up a JCI standard, which may not have been most apt. So I think one of the biggest building blocks we have, and the second focus, like you're saying, the infrastructure, the process is very much in place. So at least in the senior care ecosystem, we're going to have better outcomes, because we always look at infrastructure process, but in our country outcomes. So someone's investing into this ecosystem, he can look at that.
Just one addition, like for price less than the price of a lunch at this place, we are offering a certification. They are very, very cost effective, almost negligible. That is one. We piloted at all the major facilities. We did it at Antra, we did it at Aurum. So all of them gave us a thumbs up, and only then did we go ahead with the form. It's a totally technologically enabled. They're the least human interface. Absolutely none. You online except the assessor visiting and certifying. So and assessors are also from amongst ourselves only. Thank you.
I think a great collaboration in co-creating the standards, which I think is really. Next, I'll go to you, Rajiv. I think while we speak and something gets focused more on the care part of it, right? But I think the senior care ecosystem, while we all, as we age, take supplements, but vitamin M is very important because you run out of money, you can't do anything. So you were telling me, how does this whole ecosystem, between 60 to 90, and many of us may live to be 100, uh, how does that need to develop?
Thank you, Rana. And I want to thank Adarsh from Primus, one of the organizers, for pulling me into this aging festival, thriving festival. And I feel so privileged to be sitting here less than 72 hours ago. And in the updated agenda, my name came in. Many of you may be wondering, that what is this guy who runs India's oldest wealth management and financial planning business? Bajaj Capital is a 60-year-old company. Many of us confuse us with our namesakes in Pune who manufacture bikes, but that's not us. We are the original Bajajes of money based out of Delhi. Uh, we are a unique business, and I'll start from the beginning. Rana, several years ago, our CEO Anil Chopra at that time walked into my room very excited. And I always keep grilling my team, what is the USP of our company? And he said, Rajiv, while we have 1.2 million customers, but I'm very proud to tell you that we have 4,600 customers over the age of 90. And that may have happened 7, 8 years ago. That was a goosebumps moment for me. And that's possibly the reason I'm sitting here today, because it opened another chapter, chamber of my brain, so to say. I started looking at my business and hence myself differently. That we are, while there are large banks and they are doing a phenomenal job, and they may be 100 times, 1,000 times bigger than us in terms of balance sheet. But I bet you there are not many companies in India which serve 3 generations of investors. And then all these stories connected up. So let's say there's a Bajaj Capital branch in Janakpuri. and the manager has been in place for 15 years who manages money for people. One old uncle, 85 years old, would say, Beta, and his son lives in US and daughter lives somewhere else. He says, Beta, आते हुए ना जब वो फॉर्म लेकर आओगे इन्वेस्टमेंट का तो साथ में मेरी दवाई उठा लाना pharmacy से. And this guy actually, the manager knows he has the list of medicines that are to be carried. So we have a senior care business integrated into a wealth management business. So that was another moment of awakening for me. So while this is not the moment, and that's what Rana, when you said Rajiv has a personal interest, this personal interest has now become a very strong professional interest. Because today my younger son Shivam is running a personal nutrition platform. Maybe these are the discussions we have on dining table. My wife is a yoga instructor, certified yoga instructor. While we are a financial services family originally, but we have gotten into healthcare, preventive healthcare in a big way. I walked into the hall there to see the exhibits. Everything was around solutions when you get ill. But, ladies and gentlemen, what I want to talk to you about today is that I want to get into the philosophy and psychology of aging. And because that's what we deal with. We are in the business of helping people become financially independent. And I saw a World Economic Forum panel discussion in 2018 on YouTube, which said that there are three things which elders are looking for. Number one is mental independence. They do not want to fall into the trap of dementia. And I've been hearing people, India is going to have one of the largest dementia population in the world. And it already has. Mental independence. People do not want to fall into that trap. Second is people want to be physically independent, on your own feet till you die. So we have actually interviewed people and gone and done research on longevity. I've been on field trips to Japan. I have TEDx talks on this subject. Uh, what people, yeah, even whether it's a granny in Haryana or whether a granny in Japan, everybody says, if I can say in Punjabi, ਕਹਿੰਦੇ ਮੈਨੂੰ ਫਰਕ ਨਹੀਂ ਪੈਂਦਾ ਮੈਂ ਕਬ ਤੱਕ ਜੀਵਾਂ ਮੇਰੀ ਜਦੋਂ ਤੱਕ ਜੀਵਾਂ ਟੰਗਾ ਚਲਣੀਆਂ ਚਾਹੀਦੀਆਂ ਨੇ. So whether you're from Chennai, upcountry, Tamil Nadu, or a granny in Punjab, everybody says, I don't know, I don't control how long I live. Till I live, my legs should work. So that also brought together another memory from my own training days as a financial planner, which was when I was a 26, 27-year-old trainee in the company, I used to fill financial planning forms for clients. And people were very clear about their money needs. How much do I invest every month? How much will it become? And how much will I have when I retire? Everything is very clear. But when it came to age expectancy, I would ask people the question, what should we fill? They would say, Are kuch bhi bhar do. I mean, I found that very odd that what is most important is your age and how you think about aging. And people said, kuch bhi bhar do. So what we have done, we've completely revamped our business model. What we do now is we make 100-year life as an assumption, which is the first page of Ayurveda, our own 5,000-year-old science. Ayurveda says, quote unquote, human body is designed to live to 100 years. It's only by our own abuse and misuse we reduce our lifespan. So hence, our thought process is that the three things our customers need is mental independence, physical independence. We should have a supporting ecosystem with guys like you and have partnerships with firms like you, because we can't be the senior care for everybody, but financial independence is our core business. And financial independence really makes you feel empowered and be able to afford all these services one is talk about. Because, guess what? We are very proud people. When I'm 90 years old, I wouldn't want my son to be paying for my senior center. If I were to go and live in Antara or Primus or anywhere else, I don't want Ashiana. So I don't want, my son paying for it. I want to pay for it myself. If I want to buy a GE gadget, I want to buy it myself. So that's where I would say people like us come in. So Rana, if we have more time, I would also later share with you, yeah, my field trips to Japan. We are writing a book on Ikigai, purpose of life. Ikigai adds life to your years, and it gives you a reason for living. We have gone to senior homes in Japan. So if we have more time, I don't want to monopolize the panel. I would hand back to you. Maybe if we have more time, I'll give you some anecdotes there.
No, sure. I think great insights, because I think that financial independence trumps everything else, right? If you don't have that, then any care is not accessible. And see, we all want to live long, but none of us want to be old, right? So that's the gist of it. Next, I come to Abhishek. So Abhishek's very important, because ultimately, the fact is that, is there a business model? We've all been talking about senior care. We've been all talking about the various models. Uh, we're lucky to have him because he's invested in companies which have looked at this space. So he can tell us, both from a financial and an operational, what have been some of the hurdles, and how does he see this market in another 3 years? Abhishek.
First of all, thank you, Dr. Rana, for having me here, and thanks all the sponsors. I think from a standpoint of investment, I'll start with what we've spoken. Right, there's a lot of demand here. There's an aging population. This is one segment which typically starts at 65, goes at 90, 100. So you have a target audience where the longevity is long. If you tap into a customer, and I'm talking from a financial as well as an operating standpoint, the LTV, the long-term value of a customer once you acquire, is extremely long. They're financially independent, and the other thing is that most of their responsibilities are done. So they've got disposable income to themselves for the right kind of products and services. So if you give them the right product services, they're willing to pay, and especially with the entire change in mindset, you're seeing that to happen. So from a demand standpoint, strong tailwinds from that perspective. The second part, which we've also spoken through the day, is that there is an ecosystem which is being built. What happens is, and typically as you've seen in hospitals and pharma, you need an entire ecosystem right from the back end to the front end, because one player cannot deliver everything. And if it's left to one player, either it falters on accessibility because it'll be catered to one micro market, one market, or it is catered, or it gets restricted from an affordability standpoint or a credibility. If you have to scale it up for a country of our size, where it's accessible, where it's not just accessible in the top 4 towns, top 5 cities, if it's affordable for the broader India and Bharat, and credible from a standpoint of where you can trust and quality, the entire ecosystem needs to be developed. And it's heartening to see that people are sort of focusing on various aspects of the ecosystem there. The third element is that how do you now get all the elements into an integrated model to say who is going to provide all of this and integrate for the elderly care? Because while they are ready to spend, they also want life simple, right? For example, my parents, they'll want life simple. They'll want one go-to person, one app to say, okay, how do you solve for all of it? I can't go to 5, 10, 15 people. So while the ecosystem is there, but how do we sort of integrate it to say that I can get to a common offerings? And we've got, from that standpoint, for example, we were fortunate to invest in HCAH, right? They're into geriatric care, assisted living. So they have not only services from a standpoint of offering assisted living centers, but also have care at home. So it's about delivering care at centers, care at home. And then we also acquired something on the product side, where we're able to provide products to the seniors for what they require, whether it's on the nutrition side, whether it's on the medical side. We're not manufacturing everything. We're trying to leverage the ecosystem which is built there and say, how do we sort of offer that? So I think from that standpoint, and as that scale, that brings the opportunity to look at it from an investment standpoint. What will sort of look at it, what becomes interesting. The operational challenges, I think, is that it's an execution heavy game, right? So it is center by center, it is city by city. You need to build it's product by product. So a lot of focus on execution. So you need to have long term patient view from a from a demonstration of track record standpoint. So I think those are the critical elements, that how do you sort of stay in the initial standpoints.
So, do you think the initial players will be actually able to build a moat, which has happened in the large hospitals, right? If you were to start opening a multi-speciality hospital today
Yeah.
and try being a pan India, it's very difficult. So,
Yeah.
do you think there's that advantage?
There is an advantage. So see, from our standpoint, where we see healthcare at home, right? HCH, it is now one of the largest there. The market is large, so there's an opportunity. There are other players. There's Atulia. There are other players who are focusing on these opportunities. So there is a head start you have. There's also an ability to convert the unorganized to organized. For what Apollo Fortis did, right? It was a largely an unorganized market at the start, and then you've sort of converted it. What it requires is a lot more push from an affordability or from a payer's standpoint, right? Because still today there is that money factor which comes where you say vitamin M. That how do you sort of have it for a 30 or 40-year period? So that will, so for example, how insurance change for a multi-speciality standpoint hospital. How do we get these models where while senior care, senior aged people have their own financial resources, but how the government, how advocacy can help sort of either reduce the cost or sort of supplement it, will move the unorganized and organized. So there will be a moat, but again, it's more execution, long term focus, which we need to be at it.
No, I think a lot of components, a lot of insights, the execution, how do you do it, and it's been different. I think even when multi-speciality hospitals, they struggled for years, right, to get things right. So a hospital which worked in a tier one city won't work in a tier two city. We have Dr. Madan Gopal join us. Dr. Madan Gopal, has a lot of experience, having worked with Niti Aayog, so over 30 years of experience on, health system research, reform in within the government. One of the things I wanted to ask him separately was, one of the fallouts of COVID was that for the first time we had adult vaccination, right? Vaccination in India only meant mother and child. Now, I think if we have built that platform for adult vaccination, all over the world, there's so many diseases which can be prevented. So, mortality and morbidity in our senior care population is impacted to a large extent that there is no vaccination program, whether it's shingles, pneumonia. So, is there any thought process on how do you do that? Because again, we're talking about healthy living.
Thank you, Ranaji. Sorry very much because the session was pulled up, and initially it was supposed to be after 2 o'clock. So I was in another meeting with the guest of honor who's going to come after this session. That's a different thing. So thank you very much for this opportunity, and this is a very pertinent question because the COVID has given us an opportunity to carry out vaccination, adult vaccination. That's one thing. It has given us confidence that yes, we can do adult vaccination. That's the one thing which has happened. The other thing is you have rightly mentioned that the population is growing, aging. If a census happens, it would be somewhere between 12 to 15% 60 plus population. And the insurance landscape is more or less, if you look at that, they are also very skeptical. The underwriters and the actuarial calculation which happens, they are also not comfortable in giving insurance to this elderly population. The home care segment is also growing. It is increasing every year. The growth is happening in the home care sector. But one of the challenging aspects is how to keep this aging population hale and hearty and well-being. We have been focusing on the wellness of this population. A network in the public sector, a network of health and wellness centers are there, right up to 3,000, 5,000 population. But that's one aspect of that. The other aspect is how to keep this population healthy, because apart from imparting the healthy lifestyle, we should be having vaccination, as you have rightly mentioned out. That how many of us here are aware about availability of vaccination about shingles, which is around 97% efficacious, and it has a life cycle of about 10 years. Because shingles is a very painful condition in the older population, and if you are not able to cater to that thing, that's another aspect which one need to factor on that. But reducing the cost of treatment for this, the other is the pneumonia. The pneumonia is also a major problem. It's a major cause of mortality as well as morbidity in the elderly population. That's one thing. And the COVID, nevertheless, we have to vaccinate the people against COVID till the time we have some confidence that this is not going to affect or create more severity. That means 3-4 conditions are there where we need to invest into this vaccination, adult vaccination. I think COVID has paved a way for adult vaccination in the country, and the shingles vaccination has been promoted in the media and the other places. I think slowly and slowly, if evidence is there, it can find ways into the national program as well. That's something. Apart from that, if you look at the way this senior care has come into the discussion dialogue of all the people, the social ministry, the health ministry, the Niti Aayog, we have all started discussing about the how to provide care to this elderly population, because they have to think about this population, and it is very much in the pipeline that vaccination and how to prevent morbidity, so that the cost which incurs in treating this population is being taken care.
No, exactly. And I think we owe it to our seniors because people who work for their life, I mean, it's being done for children and mothers, but at that stage, there is no support. So I was very glad to hear that there's a component. We just have a couple of minutes, so I'll just ask a few, short questions. Dr. Kochhar, now we won't have you have the NABH hat. We'll have you wear the physician hat, right? So one of the biggest changes which has come is that something like obesity was not a disease, right? But today we are treating it as a disease because you have a drug. Do you see aging also being treated as a disease in 10 years to come?
Oh, that's the eternal quest actually. So I'm speaking as a dermatologist. There's so much of research going on in the fountain of youth. I mean, the beauty industry, it's a multi-billion-dollar industry. And nothing exceeds that 40% CAGR and all that, right? But there's so much going on the telomere phase, the length of telomeres. So that's where the actual research is going on, and probably they have some solutions on the west coast of the US, where but they are prohibitive. But as it is with everything, research has to be there, but you have to deal with the eventuality, right? You have to deal with it pragmatically, but it's here and now, and we must start with very simple steps, as Dr. Madan Gopal very rightly pointed. The Shingris is available. It's no doubt very expensive right now. It's about 12,000 rupees for 2 shots by GSK, but you have to bring it, and the government of India can sensitize people, so at least the vulnerable group amongst the vulnerables, they we should start with that national campaign, the pneumococcal vaccine. So that's where, because one rupee invested into that prevention will go a long way in making the rupee go further, and it will be a real value for money. So
No, thank you. And I think, I used to ask the audience, if we came here 10 years later, what would we talk about? Maybe I'll move that to 50 years later and we'll have the same panelists. Uh, Rajiv, so, you were telling me, and very briefly, some of the things as we building this ecosystem, right? Japan's done it, like I said, the silver tsunami. What are some of those learnings? Because you went there, you spoke to people. What are some of those things we can adapt and actually catalyze our growth?
Absolutely. So, thank you, Rana. There's the potential of this ecosystem, and our business is a case study that given that a large percentage of population would be aged. So whether you're a wealth manager or whatever business you're in beyond, conventional healthcare, everybody has a role. I think that's the point I put across in phase one, and to understand who people are and how they're aging. So to go into the psychology of aging, which I spoke earlier, people want, the first phase, as we say in post retirement, is contentment, where people want to travel and enjoy life. In fact, their financial expenses are higher than before. When they are late 50s or early 60s, if 60 is the age of retirement, your expenses go up. Next is disenchantment, where you start to lose self-esteem, and that's when you need things, injections like ikigai and purpose of life. And then people slowly, third phase is reorientation, re-engagement, and then certain community services and projects. So that's what I want to tell you about. And last is routine. Ultimately, people settle into a final rhythm or routine, whether it is within the 80 square feet room they live in, or it's a community, if somebody can build that. We see these as the four researched post-retirement phases. Uh, what I saw in Japan, and this is being featured in our upcoming Ikigai book, which I'm writing with a Japanese professor, clinical psychologist, and other authors. We we went to a center in Fujisawa, 50 kilometers out of Tokyo, Aoi Care. And it's a Kato-san, what he has done is something unique. It's a group of 8 or 10 houses. It's a community of houses. It's not a boundary wall. In fact, he got fined by the local community. Why haven't you created a boundary wall? And he fought. He said, I am not creating a jail. I am creating a community where elders are served by members of community. So people come and volunteer. His life experiences led him to believe this is where I would want my parents to be ultimately. So he designed a service like that. It was a beautiful place to be. Elders feel at home, and that's what re-engages them and into the community. Another model started by a youngster called Hamano-san. Engao is that startup. He's just 31 years old. In Japan, as you know, there are a lot of abandoned homes. So what he did, he went to the council and started taking over these abandoned homes and made them into community cafes. So they were daycare centers for little children and senior centers rolled into one. So guess that what's happening? A dementia patient who's moving around there has a young child coming up and asking for help on homework. So what is that? Just imagine the kind of interaction that is happening, and obviously people are supervising. So it is that has really taken off. So these are innovative models, in care, which India should adopt, and they'll come up. And the silver tsunami hopefully should become a silver streak or whatever other name we can come up with. Thank you, Rana.
No, no, that's wonderful. And they say, life comes with an expiry date. Only thing it's not printed on our back. So if it was, we'll live life much better. Abhishek, very briefly, what you're saying is now this whole improving lifespan, actually is now becoming an opportunity rather than a cost. So how do you see it from your viewpoint?
So I think, as Rajiv was saying, right, there's beauty in aging. And if you look at aging as a disease and you sort of put those as models, most of the elderly will sort of, not take it up, and they'll say, don't treat us as aged or diseased. We are not like that. There's a beauty in aging. And I think from that standpoint, uh, what people are looking at is how personalized you can do it. While we are saying personalized, it does not mean that you have a different product for different person, but how personalized to each individual you can make it. Whether it's about making sure that they're staying outside of hospital as much as they can, or whether it is about how do you provide them the right product services outside the home, outside the hospital, at their home, and more importantly, help improve their quality of living. So whether it's on the product, tech, service side, those are some of the models when integrated will be interesting to see.
No, I think comes down to the quality of life. We would have continued. Unfortunately, run out of time, so I won't be able to take some questions. But I'll just like to conclude with something what the father of the nation he said. He said the true measure of any society can be found in how it treats its most vulnerable members. So I think we owe it to ourselves and we owe it to our seniors. Thank you for being a wonderful audience.
Rana, if I could just take your permission to give a recommended viewing if people haven't seen, excuse me, Live to 100 documentary on Netflix. If we haven't seen yet, it's an eye opener, and for all of us, in this space, it would be something we'll pick up from. Thank you, Rana, for being such a great.
Thank you.
Thank you so much, esteemed panelist, for that wonderful session. Thank you, moderator of the session, for wonderfully conducting and concluding the session. We would now like to present mementos to our panelists, and may I request the moderator of the session, Dr. Rana Mehta, to kindly present a memento to our speaker, Mr. Abhishek Yadav. Thank you so much for sharing your information with us. May we also present a memento to Mr. Atul Mohan Kochhar. Thank you so much, sir. May we thank Dr. K. Madan Gopal. Thank you so much, sir, for joining us. A huge round of applause as we thank all our speakers. A huge round of applause as we thank Mr. Rajiv Bajaj. Thank you so much, sir, for sharing your thoughts with us. Indeed, a very interesting session, and I'm sure most of us would have some questions or maybe some discussions. We could take it over our networking lunch.